Hello, everyone. Welcome to this session of our Law Transforms Masters Week 2021, where we will be listening to Pierina Benavente. She will be presenting her research, her master thesis titled Identifying Viable Policies for Including Venezuelan Refugees and Migrants into the Peruvian Health System. So, before we started, we were having a little bit of a conversation here, and we remember that exactly 1 year ago, before the whole lockdown started, we had the master's week of last year, where Pierina presented the design of her study for the master thesis. And at the time, of course, the topic of health services for refugees and for migrants was very important. And but we didn't know the whole new dimension of importance that it will have during the past year and now, yes, more especially, no? So I was asking Pierina how was it possible for her to collect her data? Pierina, so you collected your data last year? Or?
Yeah, no, I collected the data on 2019. It was just before COVID, like 2 months, 3 months before it started. I gathered all the data, so I was lucky. I could travel. Yeah, I could travel to Peru, and then returning here, everything happened.
Very lucky indeed. And so thank you and congratulations on completing your master thesis on this very important topic. And now vaccinations are an issue, and for migrants, especially in Latin America, is a very important topic to discuss. So you will be telling us about possible policies to implement in order to extend health services for migrants from Venezuela and for refugees from Venezuela in Peru. Yeah. Okay, so today, Pierina, who is one of our colleagues at Law Transform, she has a master's degree in global health at the University of Bergen, and she's currently working as a research assistant in the In COVID Norge project, which focuses on
migrants and COVID.
And COVID in Norway.
In Norway.
Her focus is on migration and health research and the development of inclusive health policies for migrants and refugees in general. Pierina has more than 14 years of experience working in the health sector and in health research.
Yes, in clinical trials.
Excellent. And to comment on Pierina's results and thesis, we have Camila Gianella, who is joining us from Peru. Camila, hi. Camila is a doctor in psychology from the University of Bergen. She has a master's degree in international health from the Charité Institute of Tropical Medicine of Berlin, and has a degree in psychology from Pontificia Universidad Católica from Peru. She currently works there at the university as the executive director of CISEPA, which is the Center for Sociological, Economic, Political, and Anthropological Research. Camila is an assistant professor at this university and in this Department of Psychology. And she's also a researcher at the Christian Michelsen Institute and the research leader for the Health and Law Unit at Law Transform. She's in Peru, she's an expert on public health issues, and she is the perfect person to comment on this study. Her areas of work include health rights, sexual and reproductive rights, tuberculosis, and also the impact of legal mobilization. So I give you the floor.
Okay, thank you. First, thank you for inviting me, for giving me the opportunity to talk about my project. And the title, as Catalina mentioned, is Identifying Viable Policies for Including Venezuelan Refugees and Migrants into the Peruvian Health System. This is the outline. I'm going to talk a little bit of everything, and I want to start talking of migrants and health. And according to the WHO, refugees and migrants can be among society's most vulnerable members. And right now, there are over 1 billion of migrants around the world. 272 million of them are international migrants. And we know that the health of migrants will depend on the social determinants of health. And these determinants varies among migrant groups and also the migration phases. We know that health systems need to be ready, need to be inclusive and responsive to all, to the host population and also to migrants at the same time. And we have this Venezuela crisis, refugee and migration crisis, is an acute one because more than 5 million Venezuelans have left the country so far. 3 million of them, more than 3 million went to South America, well, to Latin American countries, mostly Colombia and Peru. And in Peru, there are a little over 1 million Venezuelans by February this year, and is the second most popular host country after Colombia. There was a survey that was performed in Peru. It's a big survey performed on Venezuelans and migrants at the end of 2018. And some of the results were that 91.5% were Venezuelans were without health insurance in Peru. 11% have get to Peru with chronic diseases. 44% experienced a health problem since arrival, and 93% were working in the formal job market. And it was before COVID. So this is the Peruvian health system, and I don't want to, of course, explain all the system. I just want you to see how complicated it is, how segmented and fragmented it is. We have different institutions, different providers, different funds, and it's very complicated to access, to deal with this. Even if health indicators have improved in Peru, and the health also in the last 15-20 years, and also the insurance coverage have increased. But the out-of-pocket expenditure is still high. The health expenditure is insufficient. It's below the recommendations. Also, I want to mention here about the system in Peru is that we have a main public health insurance scheme that calls the CIS. And this scheme covers more than 50% of the population in Peru. And also we have these programs by results, that these programs are like vertical programs that you don't need to have health insurance to have access to these programs. And these programs are targeted to major health concerns in the country. So we know that, okay, health system must be able to respond to migration. And now all the global plans, the regional plans are based on Europe and Middle East context of migration, and really Latin America migration is under research. At this point, we all need to work together and identify the migrant needs in the region, of course, create and modify policies, health policies, so we can integrate these migrants into the host country. And of course, the Peruvian health system need to do the same. The impact in Peru has been very severe. It's a lot of people. We were not used to receive this amount of people. We were not prepared. So we were like asking what to do, right? And the main objective of this work was to identify viable policies for including these migrants into the Peruvian health system. And I use a DELPHI method to do this. And DELPHI method is a consensus building method. And it's good, it works good with policy related topics, sensitive topics also. And the participants in this method are experts on the field, and it's performed through different stages. And each stage is aims to get a greater degree of consensus than the previous stage. And then in each stage we we apply questionnaires, and we analyze this information, of course, with descriptive statistics. And then at each round, we provide the results of the previous round to the participants. So it's kind of interesting method to apply. And I use a modified DELPHI method, and this is my study design. And you can see I performed 3 rounds. And in the first round, I performed a literature review and interviews. Literature review of global plans, of national plans, regional plans also, all about, of course, policies to integrate migrants into the health system. For interviews to key informants in Norway, out of Norway also. And I perform a documentary analysis of this information and create a questionnaire. And this questionnaire has 65 statements, and these statements are the potential policies to be implemented. And I asked 3 questions and you can see in this example, I asked 3 questions for each potential policy. I ask how desirable it is, how important it is, and how feasible it is. And I took the questionnaire to the second round. And the second round, I performed the second round in Peru. And I have 21 participants from different organizations. And I performed a face-to-face meeting with each one to apply the questionnaire. And after if the round finished, I perform a descriptive statistic analysis to measure the degree of consensus. I set up the degree of consensus as 80%. Then I performed the third round in Peru. And in the third round, I took all these statements that did not get consensus in the previous round to this round and apply it the same. I get I had face-to-face meetings with each participant and apply this questionnaire again. And at the end, I analyze it with frequencies, and I also obtain the mean of the importance and desirability question to rank the statements. I also perform a qualitative data analysis, and this is because I have the opportunity in this second and third round to meet with the participants. So I have 41 meetings, and I could get information because they were completing the questionnaire and also they were commenting on each of the questions. So I could tape record it and transcribe this information. I perform an analysis of this data and I use a role order matrix because I categorize the data by roles and analyze between and across roles. So the results, the statistic result from a DELPHI rounds, I get 70 statements that reach consensus in all 3 dimensions that are very desirable, very important, and definitely feasible to implement. But these 17 statements were more related to services that are already being provided to all. It's maternal health, child health, immunizations, HIV, tuberculosis. Then I have 6 statements that did not reach any consensus in any dimensions. These statements were more related to specific services for migrants. And then I also create a priority list when I rank the statements. Then all the findings from the interview, from the qualitative analysis, also confirmed the DELPHI results. But there were 2 only, except for 2 main issues that were not, did not come up in the DELPHI results. And these 2 issues were that there was no clear leadership and stewardship in the migrant health discussions from the government, and also promotion of research on migrant health in the country. With all my results, I could create a policy recommendation list. 17, the list has 17 recommendations, and my recommendations are based on how feasible are these potential policies to implement, and also the ranking. And I would like to discuss a little bit about some of my results. And for example, when talking about universal health coverage, we know that a strong system can achieve universal health coverage, but the Peruvian system, as I mentioned, is not strong, is very segmented, fragmented. It has these vertical programs that are strong, but of course also they are not perfect. So, and also they fragmented more the system. And what all the participants say during the meetings is that, okay, the only affordable option for the Venezuelans is the CIS, that is the main public scheme. But there is a barrier, and the barrier is that the residents, most of the Venezuelans in Peru have a legal permit, but they are no residents, and it's a requirement. So it's very difficult, but still most of the participants thought that it is at least is possible, feasible to open these doors. But also I need to mention here that in Peru, even if you have CIS or any other insurance, this does not guarantee access to care. This is a problem with the systems, and I'm thinking in Latin America. Then talking about equity in health, the structure of the system in Peru, it's already inequitable. And most of the participants also say, okay, the Venezuelans have the same access that uninsured Peruvians. And so we can also interpret this, okay, they are prioritizing equality over equity here. And what they say is, okay, if we give something special, if you get some special services also, it will increase the xenophobia in the country. And the xenophobia is a big problem also. But I want to mention something that happened after I ended my field work, that in November 2019, a law was approved in Peru. And with this law, all the uninsured Peruvians that by that time it was 12% of the population, they will have access to the main public scheme. So in theory, at this point, there should not be Peruvians without health insurance in paper. So this adds an extra layer of exclusion for migrants, because still the migrants does not have this access. Then if we talk about vulnerable groups, many vulnerable groups are addressed with these vertical programs, and all have access. You don't need health insurance for this. So we have also the Venezuelans has the same access than Peruvians. So it's children under 5 years of age, then maternal health, also HIV, tuberculosis, immunizations. So all have the access to these programs. Some programs are very strong, not perfect, but strong. But then there's a couple of groups, according to our participants, that are unprotected and vulnerable at this point between the Venezuelan population, and it's children above 5 years of age, and also Venezuelan women victim of gender-based violence. And gender-based violence is a big problem, is one of the most critical concerns in Peru in the last few years. So still, they are working on this, and they say, the participants, that it could be more difficult also for Venezuelans to get access to some services here. If we talk about chronic disease, NCDs, you will need health insurance to access to care, and also for free emergency services, you will need health insurance. The Peruvians will need, and also the Venezuelans will need health insurance here. But chronic diseases were not considered as a priority because it's a healthy population, according to participants. And then when we talk about mental health, the services of mental health in Peru, it are in early stage of implementation. They're trying to improve this, but it's not, the quality of the mental health care is not good at this point. They are working on it. They are doing a lot of efforts, but it is still early. And so at this point, Venezuelan doesn't have any access to services to mental health, near Peruvians really with insurance. So it's a big problem. And here it is the NGOs and also UN agencies that are helping the migrants and refugees with mental health. And also they mentioned, participants, that emergency services is an economic burden for Venezuelans. There are young people and they are exposed to accidents, to also violence, trauma, and it could be a burden for their economy. And I want to talk about the government also. Peru was not, did not receive many migrants in the past. So they were not ready to receive this amount of people in a short period of time. And here the government was not ready, and there is not clear leadership and stewardship in migration health discussions. And leadership is crucial. And that's what all the participants said, but there was not a leader, and they want someone to lead in these discussions, to get, of course, to create policies and to change also. Also, no proper information systems are not working good in Peru for anyone, and migration health is under research, so they need also to improve this. Then incorporation of Venezuelans with professional health training. By the time I was doing the field work, they was trying to work on this to include people. There were a lot of professionals, but it was kind of, there were a lot of barriers. That these barriers start to going down after the COVID. The government started to include Venezuelan health professionals into the system to help with the COVID pandemic. So that was a good step over there. And then xenophobia. Xenophobia arises a lot during my interviews, and what they say is, okay, it's the central government that must address xenophobia. They need to create campaigns. They need to sensitize people about migrants. They need to disprove myths. And they say, okay, yes, of course, it's the central government. MOH also need to do some things, train the resources, cultural competence. So it's a lot to do to fight xenophobia in the country. And xenophobia is a big problem also in all countries in Latin America regarding Venezuelans. And to finalize this discussion, I want to talk about health promotion. You can see here that my first policy recommendation is to implement health promotion campaigns to inform Venezuelan refugees about the rights, the use of health services, and the prevention of prevalent diseases. And this is the only point that got consensus in very important, very desirable, and definitely feasible to implement. So that's why I put it as a first recommendation, because they can do something about it, and it's very important for them to know what they can access at this point, right? Pretty fast, I want to mention my limitations and the strengths of my study. The DELPHI method, there is not standardized guidelines for this method. So it's very difficult also to take decisions. You need to take many decisions beforehand. You need to calculate the level of consensus, how many rounds you are going to perform. So there were many things that we need to think about it before. And of course, it can affect the results. And then using 3 dimensions can be a little bit confusing for the participants. So at the end, I realized, okay, maybe it would be better to use 2 in the future. Then we have the participant bias in the responses, because the barriers that affect the provision in general for everyone in Peru. And then the strengths is there was anonymity between the participants. Then a selection of participants of high level of expertise. We have former ministers of health here, senior advisors, directors of institutions. So there were people involved in policymaking. And then it was a balanced sample with high response rate. And these face-to-face meetings permit to collect more information, and I could triangulate all my rounds with different kind of data. So I like that. And to conclude, I want to read this quote from one of our participants. For different reasons, we cannot give a migrant what we do not give to a Peruvian. This could also be interpreted the other way around. What is given to a Peruvian will be fully desirable to be given to a migrant. And that's like a work premise. And that means that now that all Peruvians in paper have insurance, so we need to move forward with even with the pandemic, we still need to move forward with the migrants. And they need to open the doors to and integrate the migrants and other vulnerable populations. And it is an opportunity also to integrate the service, integrate the system in general, all these fragments. And yes, I think that's everything I want to share with you. Thank you so much.
Wonderful, Pierina. Thank you so much. Thank you for this very interesting presentation. I have some questions already, but before, out of curiosity, because in my home country, Colombia, we are also going through similar discussions, and it's really important to level up the discussion, even questioning if Venezuelan migrants should or shouldn't get vaccines. So, okay, but let's listen to Camila. Camila, the floor is yours. Thank you for commenting on Pierina's.
Thank you for the invitation, and thank you, Pierina, for this great presentation. It's nice to see the results of your job. That is fantastic. As you say, there's not much about the migration in Latin America. There has been some works on Colombia because of the load of migration, of the Venezuelan migration there. There is a huge humanitarian crisis there. So and that has been forced, at least, that to have some more broad debate in Colombia, especially in some part of the countries, no? But in Peru, no. And I think that is also because the region is of the political meaning of this migration, because they are running out of a regime that has been criticized and supported by different leaders. And I think that at the beginning of this big load of migration, there was some more openness from the government, and they opened the doors and say yes, because that's more like a political statement against the Maduro regime. But when the people come, they didn't get any responsibility. So I think that is also important. And I think there is a political statement there, and this is intentional that they are doing this, so they just neglect the situation. And despite of the Inter-American Commission of Human Rights statement saying, okay, you have to do something, no? So you are so critical to Maduro, okay, we are with you there, but there's people there, so we have to make something with the people. The other thing I think that is important to say about Latin America and to understand better the Pierina's results is that this is there is a lot of inequality and inequity in the region, and there is a lot of segmentation and a lot of discrimination. So segmentation and discrimination is normal. And people doesn't have labor rights, and people doesn't have access to healthcare. So you have a huge proportion of the population that are used to that. So that's a normal thing, and I think that is also important, because it's like, yeah, I mean, they are in the same situation than us, and you say it's not the same situation, because the situation was to be migrants that has been forced to abandon their country, put them another layer of vulnerability, but in a society that we are so used to discriminate, it's difficult then to have this kind of discourses. And the other thing is, in addition to what Pierina says about the health system, yeah, it's a health system that is segmented, it's a health system that is super restricted, the coverage doesn't mean access at all. And also in this idea of these vertical programs, these programs shows what is the understanding of healthcare. So it's more like a health system that is put in place to fulfill some indicators that are aligned with the international sustainable development goals. So because you see these indicators just respond to these sustainable development goals, but doesn't mean that that this contribute to have a strong health system. And I think that is one of the things that we see in the situation of the COVID in Peru. The dramatic impact is because we have a health system just to fulfill some indicators and not to provide a comprehensive healthcare. So, and yeah, in theory, you don't have the need of health insurance to have access to tuberculosis, HIV, and that's true. But there is a bureaucratic barriers to have access to that, even though, because yeah, you have the access to antiretrovirals, but you don't have the access to all the other exams, because for the other exams, even though are included, they are going to ask you for your CIS card. So there is a lot of bureaucratic barriers that are in place for Peruvians and also for Venezuelans. And then you have to add the thing of the discrimination and xenophobia and all these kind of things. The role of the media that has been portraying Venezuelans as super dangerous, people that come to the country as criminals. That's also key. This is something that has been going up and down, and now in the elections, this has been going up. During the COVID, I think, as Pierina said, there was a small window of opportunity to open the floor for some health workers to work in the health sector. And there was a lot of Venezuelans, because of the situation of crisis, that they were working on cleaning and going for the corpse that were in the houses. So that was also the work that they took. And because no Peruvian wanted to do that. So that was also something that was portrayed as see how Venezuelans are doing this also. But in a situation that that we are so used to the segmentation is difficult, but also is interesting to see how these high rank officials that Pierina have access, what is their understanding of the health system. Oh yeah, under 5 years old, okay, but because all the planning of the health system they do this in taking into consideration these indicators and not understanding, okay, how we do to provide a comprehensive healthcare, and unfortunately this is not changing with the COVID-19, no. So I think that is something to stress, and the situation now with the COVID of the Venezuelans has been absolutely neglected. I think in almost all the countries. In some countries there has been some debate on access to vaccines. In Peru we have not even have that debate, and according to the plans they are not included. But also in this country is the access to vaccines has been rolled out super segmented, so and it's according to your insurance situation. So you have been working as a formal employer with a formal employment, or have access to the social security. You are the elderly are vaccinated, but if you have a parent over 80 years and they don't have been in the social security, they are not vaccinated now. So we are doing that kind of segmentation, and it's absolutely normal. That has not been creating any kind of debate, because that is normal in this country. So then it's super difficult to explain why, if we segmentate, why we are not going to take out the Venezuelans. So yeah, so that makes the thing super, super difficult. But thanks a lot, Pierina, great job, and congratulations.
Thank you.
Thank you so much, Camila. I don't know if we have any questions from the public. If not, then I will take the opportunity to ask you some more questions. And now listening to Camila as well, I'm, health in Latin American countries, in Colombia, Peru as well, Venezuela, it's still very much considered a favor from the state, more than a right. Having access to health is considered success in society. If you have a job, you need to study in order to have a job, in order to access healthcare, right? But for most of the population, as Camila said, it is not considered something you just have the right to have because you're a human being that needs healthcare from the state. And so I see how difficult it is in the study that you conducted to see how important people think changing health policies is, and also how necessary and how feasible. And when it comes to importance or not, people can have different approaches. And I think during the past year, because of the pandemic, it is an issue of public health. So your health is important for my health, right?
Yes, exactly.
Maybe that changed the perspectives a little bit, or what? I would like to hear your opinion on that.
Yeah, I think that's my impression. Also, as with the pandemic now, I think the Peruvian population, well, it's not only Peru, in many countries, realize how important it is to have like a strong health system. We realize how bad it was. Okay, people involved in health discussions knew, of course, about this, the segmentation, how like it's no connection. So everyone do whatever they want, and it's very separated. And now we are seeing the consequences of this. And I think now people is more involved in health discussions, even in circles that used not like talk about it before. And I think that's important. It's under the eyes of everyone now. And I hope they can do something more here. We can have more financing and everything they will give. I hope, I'm not sure, what do you think, Camila, that's the financing of health, the health expenditure, the public expenditure in health will increase. I hope that if they want to really change the system and integrate everything. I'm not sure, Camila, if you want to add something here. It's
Yeah, I was expecting that this huge shock of the COVID-19 will make will bring more debates on how that we need to improve the health system, no? And why it's important to have a public health system, because the load of the pandemic has been absorbed by the public health system, but not by the private. I mean, the private sector is small, and they don't have the capacity that you have in the public one. So the flexibility to say this huge hospital is only going to be COVID, and you put all the other patients in another hospital, that you have that kind of flexibility that is not in the private sector, yeah, and they don't have the capacity to do that. But still of that, here the discussion is we need more private sector, because they are the only ones that they are making the things in a good sense. Even though that we have been seeing the perverse effect of having the private sector involved in monopoly of the oxygen, and the perverse effects of the in the drugs, and that is, that there is the discourse, because this is a super segmented society that you have been saying to people for the last 30 years, you have to buy your things, you don't have to trust in the state. The level of distrust on the public sector is super high, and the politicians also, they are repeating this, and so I was a little bit I don't know, with some hope in October, September last year. Now I just lost the whole hope, seeing the debates that are now in place. People want to just skip the line of vaccination. They don't believe in priorities. Even you say, okay, it's your grandmother. I mean, we want to vaccinate first your grandmother, and you just have to wait and say, no, why? If I can buy, I have to buy. So the vaccine. So it's difficult. And I think it's not only Peru. There has been discussions in many countries. It's just that in other countries, it has been stronger and be able to respond faster than that in the case of Peru. But here is also election years, so Venezuelans are also in the table. They're saying that we have to more or less take out all of them, and to take out in a bus and put them in the front, in the borderline with Ecuador, Chile. We don't care. They have to be out of the country. And also the thing of the vaccines, and that has been super politicized here. So
yes, I wanted to mention also that when I performed my field work, there was a political crisis. There was they were, and still last year it's been political crisis all year, and they have a huge impact in everything, in all the discussions, also in the news, also in everything. We have a lot of scandals also related the vaccination and the vaccines and the studies, the research, the trials. So it's really complicated to deal with this situation, with the COVID, in this political crisis, with this also refugee crisis in the country. And of course, it is the vulnerable population that it's having the impact, and the severe impact on this. Yes.
Right. I don't know if in Peru there is also a discussion about differentiating documented and undocumented migrants from Venezuela in order to access.
Yes, they mentioned that a lot. The thing with the documentation is most of the Venezuelans in Peru were legal, but the thing is, like, during the pandemic, they could not renovate and update everything. So, but there was some flexibility from the government with that kind of permits. But still, the majority is illegal. But yes, we have undocumented. We don't have exactly the number. It is not clear how many people without documentation. Yes, they divide something in the, and of course they, as Camila mentioned, now it's about saying the media, saying, okay, these crimes, they relate the crimes to the migrants. So, and the xenophobia increase with this. So it's a big problem in general.
Right. Yeah.
And it's normalized. I mean, you see, like in some moments on some of the pandemic, that you were making the free distribution of masks and face covers in the markets. But for that, and this has been implemented by many local authorities, for that they ask your ID. If you were Venezuelan, they were not going to give you that. and we say, okay, I mean, you are crazy. I mean, if they don't protect, they are not protecting the whole thing. What is the sense of this? We don't care. So that is the level of the.
Of course, they didn't have access to all this economic bonus provided by the government. They didn't have any access to those. And at this point, I think that they're going to release a new study on migrants, but it is a fact that of course, food security it's worsened. And then they are more exposed to everything. They are also afraid to look for attention in the health system. Even if in case of COVID, they have the right to go to the health system, but still the system is collapsed. So at this point, no one has access because it is collapsed. Yeah, proper access because it's collapsed. But now I think it was NGOs, UN organizations that were helping the migrants during last year. And I think it's just help from everyone. It's not the government that is doing something at this point.
Right. And then it makes this idea of health as a favor even stronger. Yeah. Or a matter of charity and not a duty of the state. To provide to everyone, not only citizens, but to everyone.
And I think the situation should be similar. I'm not sure in Colombia and with the migrants. Of course, it's a big problem. You have Colombia have 1.5 million, I think, of Venezuelan. And yes, I think they will have the same barriers, similar barriers that they Peru.
Absolutely. And I mean, when they don't have documentation as migrants or residence permits, it's not necessarily because they are illegally there. It's because also the state doesn't have the bureaucracy, doesn't offer the possibilities for people to get documentation. It takes a lot of effort for them and a lot of lawyers helping and people helping them reach state services for this. So it's kind of punishing them for the third time. First, because of the crisis in their own country, then because the host countries cannot really welcome them properly as new residents with all the rights, and third, because they cannot access healthcare, and now even in this pandemic. As Camila said, I also had a little bit of hope last year because for many Venezuelans in Bogota, especially, but I guess in many other cities, they couldn't work more. They were working in the streets, selling things, like having informal work, and they couldn't do it anymore because of the lockdowns. So what happened is they couldn't, they were families, and like mother, father, kids, many people, so they couldn't really afford paying rent anymore. And then before the pandemic, nobody really, nobody, it's not true, but many people with xenophobic ideas didn't care about this, right? It's their own fate. But now, because they became a matter of public health risk for the others if they are outside, then the state was providing some shelter and paying rent for them for some months. And then we thought, okay, this might be a very strange opportunity to include them in the state services. But I think later the health was taken from them, and they had to walk to Venezuela again during this pandemic. Just go walk because there was nothing for them. And it is really a tragedy. It's a human rights tragedy, what Venezuelan people are living in South America, really. Pierina, but I wanted to ask you, because we still have 15 minutes, I'm not an expert on public health issues. So I just want to take some take-home messages or lessons from your thesis. You were studying viable policies, right? To try to understand what kind of policy can be implemented to extend health coverage for Venezuelan migrants. So please, a very easy summary for me to understand what kind of policies are viable according to what you mean.
The first one, and I mentioned during the presentation also, is to implement campaigns, is health promotion campaigns. That was for me, when I was doing these interviews, it was, of course, I noticed that there were a lot of things that they could, a lot of services that the Venezuelans could access, but many of this population does not know where to go, what to do, or what are the rights. So they, as Camila said, okay, we have these programs by results. It's just to, I don't know, to fulfill some numbers and indicators, but still Venezuelans can access to these services, but they don't know. A lot of people, they don't know. And a lot of my participants that interview also many migrants, they say, okay, they don't know, and we need to go to the special, of course, regions, to the special districts, and provide this information. We need to create campaigns. And for me, that was the most important thing, because according to everyone, it's so easy to do it. It's so easy, it's definitely feasible to do it. And it's one of the most important. It was ranked 2.
Okay.
So, and it was the only one, I think, in the top 5 that is not being provided so far.
Wow.
So I think that's a good start point to show them the way to go. So don't be afraid. You need to, of course, they are afraid also of xenophobia, and they can receive they can receive some I don't know how to say this. I think that they can be treated badly during detentions in some of the providers. But here also, I think it's in another policy to implement was also to train cultural competence, to train health workers on migrants' rights. So we need more. But interesting, in my study, what they say when we talk about this training, most of the participants say it's not necessary. It's because we are similar people, we have the similar culture, so we speak the same language. So this is not too important, but I think it is. It is to fight xenophobia. And this is also a very important message I get from my study. And I'm not sure, Camila, you were saying, yeah, it is true, because there's a lot of people saying it is not necessary to the cultural competence. It is not necessary to train.
Yeah, or the language.
Yes, because it's similar. We are Latinos, and but no, I think it's very important. I'm not sure if you think the same, Camila.
I think it's very important because, again, this is in theory, you have this access, but you are going to have to face a lot of administrative, bureaucratic barriers. That is, the health provider is not going to give you the access and can mistreat you. And health providers mistreat people a lot because they are super. Yeah, they discriminate, and they have this understanding on what is the good behavior that you have to have. So, and there is all this stigma around Venezuelan women, there are prostitutes, so all these things, and so they are going to be nasty with them, and that is also related with the thing of gender violence. So yeah, we can give attention to pregnant women, but not for women that has been raped. And there has been a lot of sexual violence against Venezuelans because they has been super exposed, walking in the streets and that. So there has to be some competencies, but it's more like for the training and to create awareness about the health providers. But also it's good just to not discriminate and treat people badly in general, because they also treat badly the Peruvians, young Peruvians don't want to health services because they are going to be facing a lot of this stigma and that the health providers have against them. So, yeah.
So it reproduces, of course, some of the problems that are already part of the system also for Peruvians.
Yes.
Yeah, reproduce the structural violence is reproduced in the health system. So, yeah.
And I want to add also about its potential recommendations. That when we were when I was interviewing the participants, as I mentioned also during my presentation, they always say, okay, the Venezuelans had the same rights that uninsured Peruvians. But they kind of knew that this law was coming, that the law about including all Peruvians in SIS, in the main public scheme, they knew it was coming. So they say, I think the president is gonna include everyone just to have 100% of coverage. And they were kind of, they have this hope that Venezuelans will be included, some of them, not all. And they say, okay, it will be, if you're already adding 4 more millions, like, okay, just 1 more million, it's kind of the same. It's because that was what they say at the time. But at the end, they were not included. And now, of course, in theory, they are like the only big group excluded without like access to the SIS. I'm not sure, Camila, I just wanted to ask you here about the SIS, because I couldn't find any, after the law was approved, also I couldn't find any percentage of how many people it's enrolled. I think it's automatic. Now every Peruvian can be enrolled in the SIS, right?
Yeah, I mean, again, in theory, we have the coverage of 96% of coverage so we are absolutely in the path to the universal healthcare. Yeah. Yeah,
in theory.
It's a lot of reality. Yeah, this is a country with a high level of exit deaths during the 2020, and this is related to COVID, that people don't access to healthcare. We have now in the levels of maternal mortality that we have 5 years ago. So this is a huge disaster for the country. We have not been able to detect. I think we have lower the 40% of the people that we have to detect for tuberculosis we have been detecting last year. So this is going to be having a huge effect to the whole system and the whole population healthcare. So, and that means that we don't have universal healthcare, but still we report that we have. So, and then some Venezuelans are absolutely in the margins of this abandonment because of how things are here.
Right. So we have 7 more minutes, and I would like to ask you both, because Camila is an expert on mental health as well. I would like to ask you now, most of us who don't really know anything about health systems or medicine, now we have a little bit more of an understanding of how mental health can affect us all, because we've been in lockdown, we are feeling more anxious and sad, and we see our family and friends changing, and so now we have a little bit more of empathy to understand the importance as well of access to mental health. And when it comes to the migrant population, of course they have especially I guess they are more at risk, more vulnerable, because they have been going through a very difficult situation. So I would like to ask you, Pierina, and then Camila, from the findings of your thesis, how do you think, what kind of policy or recommendation can be implemented to
regarding mental health? That is difficult, because mental health is a big problem in Peru in general for everyone.
In every country in Latin America, exactly. There is no access in public.
And the thing is, like, even if you have insurance, I think mental health is one of the most like the services not working. We don't have many providers, we don't have many specialists neither. So, but they are working on that. I could, during my interviews, they talk about many of these programs. They are trying to do some community groups. There's a lot of plans, but still it's in early stage of implementation. So it's not working for anyone. So, and of course, this population, refugees, are vulnerable. So mental health is very important. So that, but I think at this point, the government is not planning to do anything special for migrants. And yes, and all these things, all the help will come from NGOs and yes, the institutions, the agencies. I'm not sure if you have more information about that, Camila.
Yeah, I mean, there is this program for the community health services, so mental health community services, but it's still, I mean, we have been extending the network of that, but yeah, to access to that, still you have the administrative barriers that people have to show that they are part of the CIS. And I think that on mental health, I was thinking again, and I have to a little bit more hope when I have been speaking about people say, okay, we have been in 1 year of uncertainty. And that is the thing that migrants around the world have all the time when you have to face this idea that I am going to have or not the work permit. The thing of I think in Norway was not so much, but here and in many parts of the world with the COVID is this you're not sure that you are going to have tomorrow a job. So so it's not only uncertainty about your health, it's also about your material conditions that you are not sure. I mean, and that level of stress that we have been through all the time that is something that the migrant has to face all the time. Most of the migrants that have access to formal work and around the world. So I think we have to think, I mean, you were feeling bad this year? Yeah, that is how they feel all the time, you know? This is a lack of, you're not feeling safe, no? Yeah. Not all the migrants, of course. I mean, the three of us, we have been migrants, even though we have been having a lot of problems with the documents at some point in Norway, it's not the same, no? To be in that level of uncertainty all the time with fear, living with fear. But also it's like fear is a luxury and in the COVID situation, because in the thing of to be afraid of being infected, because the type of job that they have to do in the host countries, like to be deliver food or to be in the streets, walking dogs and that, they are not having this luxury of being able to be afraid of getting infected. So and that makes a lot of things in your mental health. And the poor population in general in Peru has not been having the luxury of being afraid. And even though that they are afraid, so this have a lot of effects, and we don't have enough services to treat this for the whole population, and not especially services for Venezuelans, no? And I think that is but probably it's a point also to put this in the table. I mean, how you were feeling all this year and how the migrant feel, and probably just to put the people in place to see that.
Oh, that's it. Thank you very much, Camila. Thank you for your comments and for this conversation. Pierina, thank you for your presentation, and congratulations again on completing your thesis. I thank you all for joining our master thesis week, and I want to leave you the last word in case you want to add anything or...
No, I just thank the opportunity to Law Transform. Thank you to all to give me this. And yes, it's been very difficult the year with the COVID, and also it's been a difficult also project to take also in Peru. But I'm happy. I'm happy with the results, and I think I can share this information with policymakers, and that's my plan.
Excellent. Thank you so much.
Great.
Thank you all. Bye.
Bye bye.
Thank you. Bye.